Inova Fairfax Hospital is a major independent teaching institution, and that is approximately 900 beds and has a level 1 trauma center, has a transplant center, has a lot of its own residency programs. It's been involved in teaching residents and students since the day it was opened.
The Inova Fairfax campus itself, it's filled with a variety of different departments, different individuals, different services. There's resident programs where we work with teaching residents, we work with hospitalists, we work with private attendings, we work with NPs and various structures, and it's something where you have to be able to navigate different roles and different elements of a hospital care system.
The hospital is a unique clinical laboratory, both the inpatient services and the outpatient clinics, if you will. Whether general primary care, surgery, subspecialty in medicine, there's an endless series of questions that face us as physicians when we hear the patients, what they bring us, if you will. And what makes, I think, our program unique is we continue that spirit.
The thing that Dr. Crone and I really share is our philosophy towards consult liaison is actually an emphasis on liaison skills.
The GW fellowship here at Inova Fairfax Hospital was such a great decision because it has so much like medical acuity, in which we're saying medically complex patients, and you're actually getting the chance to be a consultant on them, compared to many places where they may not have certain medical facilities, compared to where at Inova Fairfax Hospital, which is a site in which we stay the entire year for consultation liaison. There are patients who are flown in from other hospitals here. There are patients who come here for advanced lung care, for advanced cardiac care, and you get to see that medical complexity and then learn how to manage those patients along with the multidisciplinary teams. And that's something you may not be able to find everywhere else.
The attendings, Dr. Crone, Dr. Vyas, Dr. McGeed, and the teaching attendings for our monthly table rounds, they toe this nice line where they're there if you need them. They're never unavailable for questions, or if you feel uncomfortable or uncertain about doing something, they'll guide you through it, but also they give you a lot of autonomy.
You will get a world-class training, I can guarantee you that. And it's not only training, but you will establish relationships with different people here, with different attendings, and the fellows that will help you for the rest of your life.
We have 3 fellows here, and that's going to other locations, seeing it. Oftentimes, fellowship can be a tough year, and doing it alone can be something that's for some people, but it just wasn't for me. I really enjoyed that collegial atmosphere, and this felt like a family.
I very much appreciate the fact that I had 2 co-fellows this year to keep me company and keep me going, to just have that camaraderie.
The quality of applicants that we get and the quality of fellows that we get has always been outstanding. I think partly because the program has always been there. It's one of the oldest programs.
Final element besides the clinical work, the educational work, is the research that we do. And over the years, we've probably published about almost 300 papers.
The schedule is structured between clinic, didactics, and then seeing patients. So a typical week would mean that, pretty much all of Monday, you're going to be seeing inpatient consults. Every fellow has a half day of clinic all year in their specialty clinic. So that means from 8:30 to 11, they're at their specialty clinic 1 day a week. So for some fellows, that's the HIV clinic. During my year, I was stationed at a primary care clinic. And then the psycho-oncology clinic with Dr. Lolak is split into thirds. So for 4 months, one fellow goes Thursday afternoons from 2 to 5, and then it rotates. So we all get at least 4 months of psycho-oncology with Dr. Lolak, who's a great supervisor. And then what is a really cool concept, which I had never seen before, is that Monday, Wednesday, and Friday from 1 to 2 p.m. we have table rounds with usually an outside attending. So for the first 2 months we present to Dr. Crone, Dr. Vyas, and Dr. McGeed, but then the other months we actually, Dr. Crone and Dr. Vyas really put in a lot of thought of bringing in outside attendings from the community with different specialties. So we rotate with doctors who work at the state hospital, private consultation liaison physicians who work with women's mental health. It's a really diverse group of people, so you get to present your cases and learn from outside attending, so it's not just insular.
Here, I like the aspect of I can choose to live in suburbia if I wanted to, but Washington, D.C. is right nearby.
Living in Northern Virginia, just outside of D.C., has been so fun.
The call here is like, it's very easy. It's actually, some weekends you won't even know you're on call actually. And basically you're carrying, you're responsible for patients that you've already seen throughout the week. And it's actually very easy. You're at home, you hardly have to come in.
At the GWU-Inova Fairfax CL program, one of the really important things is our relationships. So while the fellowship program may be 1 year and you're there to learn so you can be proficient at CL, the relationships are meant to last a lifetime.
So if you are looking for a CL psychiatry program that would be comprehensive, mostly seeing the pathology that you want to see in CL, seeing the variable kind of like patients, different backgrounds with a cultural and psychosocial component, having the general CL psychiatry training as well as subspecialty training, this is the place.